How eMedica helps in the treatment of paralysis. Understanding paralysis. Paralysis occurs when the brain or spinal cord loses its ability to send electrical signals to the muscles. This may result from stroke or brain injury, damage to motor control neurons, spinal cord injury, disrupted nerve conduction between brain and body, neurological diseases such as multiple sclerosis or motor neuron disease. The root problem is loss of electrical signaling and reduced cellular energy in affected areas, leading to muscle atrophy, poor circulation, and impaired healing. Why 3 programs are needed? Paralysis program stimulates the paralyzed muscles and nerves locally, restores microcirculation, and recharges cells with electrons via VCF therapy. Voltage, current, frequencies. Helps prevent muscle wasting and improves responsiveness. Brain disease program targets the root neurological cause, stroke, brain injury, or degenerative brain disease. Enhances neuroplasticity, the brain's ability to form new connections and reroute signals. Improves neuronal repair, synaptic signaling, and motor cortex activation. Spinal cord injury program focuses on the signal pathway between brain and muscles, often disrupted in spinal cord injury. Delivers microcurrents and frequencies that promote remyelination, repair of the protective sheath around nerves, improve axon regeneration, and synaptic reconnection across damaged spinal segments. Reduce glial scar tissue effects, which normally block signal transmission. Enhances neurotrophic factor release, like B, DNF, and GF, which are essential for nerve growth and repair. With spinal cord injury, the body often still has viable neurons below the injury site. eMedica helps re-establish partial conduction and supports spinal plasticity, where alternative pathways are recruited to restore function. Role of water intake. Water is mandatory because it acts as the body's electrical conductor, ensuring proper nerve conduction. Provides electrolytes, sodium, potassium, calcium, magnesium, necessary for action potentials in neurons. Enhances detoxification, reducing oxidative stress around damaged nerves. Without proper hydration, electrical signals slow down, reducing the effectiveness of therapy. Why improving electrical signals in the paralyzed area is critical. Healthy nerve cells maintain a resting potential of negative 70 millivolts. In paralysis, this charge drops, reducing signal transmission. eMedica infuses electrons, restoring cellular charge and ion channel activity. Microcurrent stimulation boosts ATP production, energy, essential for nerve and muscle recovery. Thus, improving electrical signaling is the foundation of regeneration. Why some patients recover quickly, others slowly. Acute paralysis. Recent cases. Neurons are dormant but not destroyed. Microcirculation, oxygenation, and ATP production can be restored rapidly. Immediate visible improvements are common. Chronic paralysis, long-standing cases, muscle atrophy, fibrosis, and neuronal degeneration, slow recovery. Requires long-term stimulation for neuroplasticity and reactivation. Progress is slower but steady with consistent therapy. The difference is based on whether nerves are dormant, fast recovery, or structurally damaged, slow recovery. eMedica treats paralysis by restoring electrical signaling, circulation, and cellular energy. 3 programs are required. Paralysis program, local activation of muscles and nerves. Brain disease program, central repair and neuroplasticity. Spinal cord injury program, re-establishing signal pathways and nerve regeneration. Water intake ensures maximum conductivity and recovery. Quick recovery happens in recent cases with dormant neurons. while long-standing paralysis requires longer therapy due to muscle atrophy and structural nerve damage. From brain to spine to muscle, eMedica reconnects what paralysis has broken.